Hello, my name is Doug Joshua, and let me introduce myself. I am now a consultant haematologist at Royal Prince Alfred Hospital and an Emeritus Professor of Medicine at the University of Sydney. Previously, I was Head of Haematology at Royal Prince Alfred Hospital and commenced the Myeloma Research Unit and the Myeloma Therapy Unit. My interest in myeloma began many years ago in the late 1970s when I studied at Oxford and did a PhD on immunity in myeloma and in an experimental murine model. But for many years I've had an interest in why patients with myeloma do not respond well to vaccinations, do poorly with some severe infections, and why some people with myeloma appear to respond to their myeloma and have inherent immunity and others do not. Today, however, I'm going to talk to you about myeloma and COVID-19. In particular, I've been asked to answer the following questions. Can you get reinfected with COVID-19 if you've had COVID-19? Or is immunity lifelong after an infection? What are the vaccinations that may be available for myeloma? And is it possible that patients with myeloma and other patients who are immunosuppressed will not be able to be vaccinated? Immunity to viruses depends on two factors. One is our innate immune response, which allows us to combat infections with generic things like inflammation and inflammation. However, the most important immune response is the so-called adaptive immune response. This depends on us having immunological memory to a previous infection, such that when a new infection occurs, we can able to respond promptly and produce antibodies and killer T cells to eradicate that infection. Unfortunately, no one has had any prior exposure to COVID-19, so there is no immunity to this disease. To allow the virus to spread in the community to obtain so-called herd infection would be extremely costly in lives and is not something that Australia or New Zealand has embarked upon. COVID-19 is an RNA virus, and it is similar to many coronaviruses that usually call the common cold. However, coronaviruses, as you know, have been associated with very severe infections like the SARS infection and the MERS infection, which occurred in the Middle East. Because no one has any immunity to coronavirus, this virus spread very rapidly throughout the world, and it is a true pandemic and nothing like we have seen since the severe Spanish flu pandemic of 1918. Because there is no immunity to this virus, there is no adaptive immune response. It is true that patients who are infected do make antibodies against the virus, and we can measure these antibodies. They are not antibodies that we can use to detect infection, because these antibodies take some weeks to develop, but they may be very useful in finding out how many people have been infected in a community, and also give us some idea whether there's likely to be any herd immunity. What is unknown is whether these antibodies will protect us against subsequent infection and how long this immunity to infection may persist. It is not known whether, like with other viruses which cause the common flu, immunity is not lifelong but usually lasts for 2 to 3 months. It is also not known whether, like influenza, this virus will mutate so that we'll have to have a COVID-19 vaccine every year to account for new mutated strains that have occurred. I would now like to talk to you about whether patients with myeloma are likely to be more susceptible to COVID-19 or will respond not as well to vaccination. In general, there are two types of vaccines. Vaccines are either a killed or an activated virus, or there are vaccines which are an attenuated virus, which is a virus which causes a weaker illness and less severe illness than the original virus, but still provides immunity against that virus, like measles. It is true that myeloma patients are immunosuppressed, and they may need more or bigger doses of a subsequent vaccine to develop immunity to COVID-19. This is certainly the case with pneumococcal vaccine. However, myeloma patients do respond to vaccination, especially if they have not recently undergone a severe immunosuppressive event like a bone marrow transplant. And as most of you know, most patients after a transplant have to be revaccinated against the common infections like diphtheria. It is my belief, however, that a vaccine will be developed. Studies in Oxford have developed a vaccine in which the proteins produced by the COVID-19 or coronavirus are implanted into a harmless adenovirus, and this vaccine has already commenced clinical trials. I'm very confident that a vaccine will be developed against the coronavirus. It may be that patients with myeloma may need a bigger dose or a higher dose of vaccine, but I'm sure we'll be able to pull through this together, and myeloma patients will be safe from COVID-19 in the future.